Good afternoon, everyone. Myself, Dr. Rajesh Khanna, consultant pediatrician at KIMS Cuddles, Kondapur branch. Today, one of the very important topic and most sought topic from the parents, that is immunization. Immunization and pediatrics subject goes hand in hand. Usually, for the pediatricians, 50%, almost 50% of the OPD outpatients we deal with immunization. Immunization word itself means that you are fortifying your body, you are fortifying your immune system with defense against bacteria or viruses. So you are protecting yourself against the pathogen. The protective means measure is vaccine. So if you are giving vaccine and protecting yourself, this is kind of active immunization. You are using ready-made antibodies. So ready to inject antibodies will give instant protection, that is called passive immunization. Vaccine, uh, when given to a person or a child, it takes some time duration to build in the immunity. It goes and stimulates the immune system to produce required antibodies, and the antibodies reach in adequate numbers. So it takes usually 2 to 3 weeks once you give vaccine. So this process of giving vaccine, either vaccine or antibodies to the person or child, this is called immunization. Vaccines are major form of preventive measures. So personal hygiene, hand wash, taking care of sanitation, food precautions, not taking outside food, not drinking outside water. So all these various measures, taking care of mosquito control measures, or avoiding waterlogging or mosquito breeding places, or wearing mask, hands and hand hygiene, all this is part of preventive measures. But what forms the core of prevention measure is ultimately and undoubtedly is vaccination. When you are given vaccine against a particular disease, against a particular pathogen, you are protected against that particular disease. Based on the type of vaccine, the defense can be lasting for lifetime, can be short lasting, or need not be 100%, it can be to 60 to 70% in certain cases, and certain situations, certain types of vaccines you may be requiring boosters also, that is more than one dose at specified intervals to reach adequate levels of protection. So this 60% initial protection which you are getting with one dose, the effect of immunity is boosted to 90% with subsequent boosters at specified intervals. So whenever vaccine concept comes to parents, what in general we think about is whether this vaccine is really necessary for us. That is our first question. So the need for that vaccine is reflected based on the incidence and prevalence of that particular disease, morbidity and mortality associated with that disease. If the disease is lethal, widespread, forming into an epidemics, pandemics kind of scenarios, and like hospitalization chances are very high. So when the disease awareness increases, definitely parents will be willing for getting their child vaccinated against that particular disease. That means you want to stay yourself protected. You don't want to fall sick against that particular disease. Now, second question which comes, is this vaccine safe enough? So, is it wise to get the disease and get hospitalized and treated, or is it better to get the vaccine because vaccine is much more safe, or vaccine related side effects are more, so you cannot take any chance in taking the vaccine because you are worried about the safety of the vaccine. Let me be very clear in this regards. All vaccines will undergo enough clinical trials with enough patient safety data, with final approvals from the government regulatory authorities. Only then it comes into the market, and we as pediatricians with our experience can boldly assure the parents that though there are many listed side effects, so the chances though less, but they are still there associated, but benefits outweigh the risks. That means whatever benefits you are getting, so when you think about the benefits, the minimal risk whichever associated with that particular vaccine is ruled out. So benefits outweigh the risks. So the first question which comes, is it really necessary? So that necessity is like satisfied, that answer is satisfied to you when you are aware about that disease, aware about its complications. For example, you know what is meningitis and what complications are associated with it, then you yourself naturally will come forward to take that vaccine and want your child to get protected by receiving that vaccine. COVID 19, when the pandemic has started and deaths were happening, hospitalizations were increasing, so that terrified note, so that pandemic declaration created panic among us, and we were eagerly waiting for some scientists to generate the vaccine against this. We were praying so to get the vaccine at the earliest. The moment vaccines are launched, there were huge crowds waiting to take the vaccine. So that need for the vaccine is voluntarily driven by looking at the complications and hospitalization rates. So the need answer is fulfilled by your awareness against the disease. How will that awareness gets generated? When you know nothing about the disease, because now due to rampant vaccinations, like increased coverage with vaccines, the diseases are the diseases incidence is reduced only just because we are giving vaccines at a larger scale. But the moment you withdraw the vaccines, again the disease will emerge. So the previous diseases, smallpox, which was eradicated, or like thereafter the outbreaks of measles or chickenpox, pertussis, diphtheria, those who have seen such diseases, they know the value of this vaccine. They will accept the vaccine much better. Now, because the parents, young parents, they don't know about the disease, they don't see the disease at all, they may not realize the importance of the vaccine. So pediatrician is the right person. Discuss with the pediatrician. So he will explain you about the disease and the complications associated, and then your decision is justified that yes, we are right in taking this particular vaccine. So you will now realize how well you are protected against such dangerous diseases. Next thing comes, apart from the safety, the minimal risk, as I told you, the benefits will outweigh the risk. So you will always consider the benefits, and minor side effects you will overlook. Uh, Other question which comes to your mind is efficacy of the vaccine. Is this vaccine really efficacious? Some feel like though I take this vaccine, I get the disease, the vaccine is useless, it doesn't protect, it doesn't make us protect, prevent the disease at all. We are still landing in getting the disease. Efficacy and efficiency of the vaccine is known to the pediatricians very well. Why? Because the disease rates and complications trend as we notice. At least, for example, the influenza associated pneumonias. So, with widespread advice for taking yearly flu shots, flu associated pneumonia rates have drastically come down. So that reflects the efficacy and efficiency of the vaccine. Of course, in the study data, in the trial data, we do have all that efficacy and efficiency data with us. So that also well assured for you. You need not worry about that doubt as well. The other question comes is the price, the pricing of the vaccine. Some are little expensive, some are not at all, not really. But the amount which you pay for this preventive measure is definitely far less compared to the bill you pay when you are hospitalized. And that too, you don't know whether you will survive for the disease or not sometimes. So, for the preventive measure, when you are paying compared to the hospitalized bills, those bills definitely will be much 100 times higher than the vaccine cost. So the disease burden on the economic burden on the society is very high when there is no vaccine. For example, COVID-19 hospitalizations, admission, you were at once the situation happened that it is difficult to find a hospital bed, and the hospital expenses were very high initially. So definitely this vaccine reduced the hospitalizations, reduced the spreads. That's how the disease incidence has come down. So the cost should not bother you. Some vaccines are definitely expensive because it is not widely given. The people's acceptance has still to be increased. Education and awareness to be increased. When that awareness is increased and many people come forward to take the vaccine, then automatically the cost of the vaccine will go down. Okay, so the necessary need for the vaccine, safety, efficacy, pricing. So all these are the common queries from the parents. Now, a brief history on the vaccines and what all vaccines are available and what is the schedule. I'll make you all aware about that. So, brief introduction for the vaccines. To begin with, there were many age-old diseases which were converting into widespread public diseases, and people used to control by simple isolation measure. Isolation was the only option. So, whoever is sick, they used to isolate them until they recovery, or if death happens, they used to take enough precautions to bury them properly in the outskirts. So basically that contact is reduced, and that's how they could manage. Vaccine, vakka, is derived from the word vakka means cow. Edward Jenner is a well-known scientist. He discovered vaccine against smallpox. What he noticed is the milkmaid, the maid who used to draw milk from the cows, her hands were getting the cowpox lesions. What lesions cow were having, and this maid, she was immune to smallpox. When rest of the people in the city were falling sick and dying due to smallpox, the lady who is exposed to cowpox from the cattle is protected. So that stimulated his thought that the virus from the lesions of cowpox, so that cowpox virus could protect us from smallpox virus. So he used to inoculate that cowpox virus into the people they all who were receiving that vaccine, so they were immune to smallpox, and smallpox was where gradually the incidence reduced. Later, on this terminology, vakka being derived from the cow, so it is the the inoculum which is injected that is labeled as vaccine, and vaccination term has thereby coined. So this is similar to kind of theory that you remove a thorn with the help of a thorn. So basically you are protecting yourself from against any particular disease with the same disease causing organism in small amounts, live form or a killed form of that particular virus or bacteria. If injected into your body, you are protected against that disease. So you can administer either in live but attenuated form. It loses its disease causing properties through some laboratory measures. So that particular virus or bacteria injected into your body, you are no more at risk of getting such disease. Killed vaccines, that's all anyways killed, and you are very less likely to get any side effects. So it is injected, or a subunit, a fraction of that vaccine also can be given to person. So live, kill or subunit. And so these are the derivatives how the vaccines are manufactured. Can be oral or injectable. There are certain oral vaccines like poliovirus vaccine or rota vaccines. We have oral typhoid vaccine as well, but majority are given injectable. And again here some are given into the skin called intradermal, or under the skin subcutaneous, like means intradermal is BCG given in the left arm. So I'll tell few words about BCG. BCG is the first vaccine received at the initial stage, like initial 1 or 2 days of the baby's life before discharge, before entering into the community. Child should receive this BCG, which is given in the left upper arm. It's called universal site of action because that's where usually we cross check later in the life if we get whether this person is immunized against tuberculosis or not. So BCG vaccine meant for preventing tuberculosis is given intradermal in the left upper arm. The site at which the vaccine is given, so after 2 to 3 weeks of vaccination, you will notice a small blister over there. Sometimes pus or blood may ooze from it. It may turn into an abscess, but it heals on its own. Need not apply any antiseptics on it. So some may get a bigger abscess, then also we don't treat. It heals on its own, and again it may rupture, and again it may form into an abscess. So that's 2 to 3 cycles similar cycles may happen. So masterly inactivity, don't do anything, it will heal on its own. Sometimes that particular abscess, you will have associated lymph node swellings, or then at which usually we also plan for giving anti-tuberculosis drugs. But that's a remote situation. So BCG is a safe vaccine given usually at the time of birth, within 1 to 2 days life before the child is getting discharged from the hospital, meant for preventing tuberculosis. That's a single dose vaccine. It is not repeated again in the later part. That gives good amount of protection, not really for the pulmonary tuberculosis, but for serious forms of tuberculosis, extra pulmonary tuberculosis like brain, bone, intestine tuberculosis. So the complications associated with tuberculosis are definitely reduced. So in the recent past also during COVID-19 discussions, the BCG's importance also was highlighted very much because those who were received BCG, for them COVID-19 complications were very less. So BCG basically being meant for tuberculosis in countries like USA, where it is declared tuberculosis free nation, there they don't give BCG vaccine. But for all those who are born in US, and planning to come to India or they reach in India, they should definitely receive BCG. So until a child is like say less than 3 years, usually once they land in India, it's the earliest is the better actually. So at the earliest they should receive BCG vaccine. Max up to 5 years this is allowed to take the BCG vaccine, but beyond 5 years it's not recommended. We usually don't give. And also doing a man-to test before giving BCG, the older is the child age, it's important to like prove ourselves that this child's doesn't have any underlying acute tuberculosis when you are about to give BCG vaccine. So that's all about BCG vaccine. Next is oral polio vaccine, which is given at the time of birth. So at the birth time, so BCG and oral polio, very very important vaccines. Oral polio is meant for protecting against polio disease. So we have two types of vaccines for polio. One is oral, one is injectable. Oral will protect from entry of the wild virus into the gut. So the chain of transmission is broken with oral. So that's why in a public health measures, polio campaigns, oral polio campaigns are run to prevent wild virus staying or resorting in the gut of the children. So not even single child should miss oral polio. On that National Polio Days, every child, irrespective of whether their previous vaccination has been done or not, irrespective of their status, all children below 5 years of age, they are supposed to take 2 drops of polio on that National Polio Day, because even 1 or 2 children are missing the chances of wild virus staying in the gut of such unvaccinated kids is still there. Then it's very difficult to remove that wild virus from the environment. The concept is you coat the gut of every child below 5 years with oral polio virus vaccine virus. So then vaccine virus, then that will not allow the wild virus to stay anywhere in the environment, and that's how we will come to eradication stage. So from trivalent polio, we have come to bivalent. That means one of the valent virus form is eradicated. So we are now into bivalent, and very soon we are heading towards polio eradication or elimination phase from our country, India. In countries where this transmission is not at all there, so injectable alone is sufficient. Now, injectable polio is for building our systemic immunity. So that anyways will take long time for us to continue to take the vaccine, because you need to have an internal immunity against. So oral polio is a preventive public health strategy. You want to break the chain of transmission. Injectable is keeping in mind of one's own individual, building one's own individual immunity. So you are building individual's immunity by giving injectable polio vaccine. So that's how your systemic immunity will build in. So ideally both are required. OPV plus IPV both are required for countries like India. Whereas for countries like US, the transmission is not there. So they will focus only on IPV regimen. They don't give OPV. The next vaccine, and usually the polio vaccine at the time of birth and at 6 months and at 9 months, and again at 4.5 to 5 years, is a schedule given for oral polio, and injectable at 6, 10, 14, and at 15 months, and at 4.5 to 5 years. So 3 plus 1 plus 1 is the schedule for IPV. Okay, usually that IPV is given in combinations with DPT vaccine itself. So the vaccine comes in combination itself. IPV is given separately also, apart from DPT, like in government centers. So IPV is given separately. The other vaccine which is given at the time of birth is hepatitis B. One of the very very important vaccine, because hepatitis B spread it's more contagious than HIV. Like you shake hands, it can spread even with sweat touching your skin as well, which when skin has some lesions. HIV vaccine we are still waiting, but hepatitis B, which is again very dangerous disease and causing fever, jaundice, attacking the liver. So hepatitis B is a deadly disease. So all the healthcare staff, whoever is handling secretions of the body, like they are handling that, they may accidentally get any needle injuries or accidentally touching the contaminated blood or contaminated dressings. So all healthcare staff should mandatorily take hepatitis B. Pregnant women should stay themselves protected, because once they are hepatitis B positive, their child should, once they deliver, uh, newborn baby should immediately receive both hepatitis B vaccine as well as passive immunization with hepatitis B antibodies. And immunoglobulin, hepatitis B immunoglobulin also has to be given to make the child stay protected against this hepatitis B disease. So these three, BCG, oral polio, hepatitis B, are given at the time of birth. Hepatitis B is again repeated at 6, 10, 14, and at usually at see, the schedule can be 0, 1 or 6, but now latest it is now made to at the time of birth 6 weeks, 10 weeks and 14 weeks. Now at 6 months again it need not be given. Now, a combination with DPT and polio, which comes with hepatitis B at 15 months, if taken also well and good, no worries about that. But this is what is more important at the time of birth, 6, 10, 14 weeks. This is very, very important. For adults, others who adults as a primary series, so there one dose and 1 month later and 6 months from the first dose. So that schedule they have to follow. So mass hepatitis B campaigns, vaccination campaigns also needs to be held to prevent that people from hepatitis B disease. Like this, we have almost 17 vaccines against the disease, 17 diseases, vaccine preventable disease. So in the pediatric practice, the other ones are, some are optional. So cumulative, there are around 25 vaccines, vaccine preventable disease, vaccines against these 25 vaccine preventable diseases. So I'll highlight the few others as well. So I have discussed about BCG, polio, and hepatitis B. Next, we have diphtheria, pertussis, tetanus vaccine (DPT), which is given at 6, 10, and 14 weeks. So at 6 weeks, the first dose of DPT. So DPT stands for diphtheria, pertussis, and tetanus. Diphtheria usually starts from throat infection involving the heart, and it's a lethal disease. So diphtheria is highly contagious. Usually, in whenever diphtheric patient is identified, highly recommended that they should stay isolated and focus on cardiac manifestations and give antitoxin as well. Otherwise, the toxin associated from this diphtheria disease is very, very lethal and very dangerous. Complications are very, very high. So diphtheria vaccine is very important, given as a part of same 6, 10, 14 weeks and 16 months, plus at 5 years and at 10 years. Similarly, now pertussis and tetanus. So pertussis means whooping cough. The cough is so classical that whoop sound itself you will be able to diagnose that pertussis, though the incidence is drastically reduced because of widespread vaccination. And here we have certain confusion to be clarified, that is painful and painless vaccines. This strategy entirely evolved from this pertussis component of the vaccine. If the vaccine component contains whole cell pertussis, so that is disease causing organism, that pertussis is is incorporated into the vaccine as a whole cell, then that is more painful and more fever causing. Immunity as such is little 5%, little on the higher side. Now the latest generation of vaccines which contains acellular pertussis, not the whole cell, it is acellular form. So this pertussis also gives protection, though initial belief of this 5% extra with whole cell now is ruled out. So almost both are proven equally efficacious. The advantage with acellular pertussis is that it gives less pain and less fever. That's why the concept has evolved as painless vaccine, painless. It's not totally pain-free vaccine. So remember, DPT also has to be given with needle and it has to be pricked. So intramuscular, during which child will cry, whether given in the government sector or in the private sector. But the after effects associated with the vaccine are definitely very, very less when given as an acellular form. So you will expect less pain and less fever when given as an acellular form. So though both are available in the private practice now, one believe that whole cell is definitely more efficacious, and the parents come and strictly want that to take. But some majority of the patients will definitely not be happy with the fever and pain associated with the shot. So they will use this acellular in majority of the cases. Now, tetanus, tetanus one of the again most important vaccine. So tetanus disease, it's also a lethal disease. So definitely protection is required, because every cut or injury with the rusted ones, because where the tetanus spores are there, we cannot predict. The soil might be contaminated and the surfaces might be contaminated. That leads to this lethal disease tetanus. So injuries, definitely we need protection from the tetanus. So DPT tetanus is mandatory, compulsory to be taken. But uh, unlike your belief that every cut or injury you go and take the tetanus shot, that's wrong. Frequent taking of tetanus shots also will lead to amyloidosis of the liver. So liver problems may happen. So don't take too many tetanus shots. The schedule is like for the child 6, 10, 14 weeks as a part of DPT only, combination with DPT. So 6, 10, 14 weeks, and again at 15 months, and 16 to 18 months, and again at 4.5 to 5 years, and again at 10 years. For all pregnant women also, the tetanus is very much required. Highly recommended that they take 2 tetanus doses. Now it's added with diphtheria as well. So DT vaccine is recommended. DPT or DT or even TT. Something should be taken compulsory. Either of these 3 combinations. So this is given 2 doses at usually at 6 months or 7 months, 6 months and 7 months of their gestation, and during subsequent pregnancy 1 dose is enough. They did not take 2 doses. So subsequently they can take only 1 dose. So that's all with DPT shot at 6, 10, 14 weeks. At 16 months booster, and at 4.5 years we have a booster, and at 10 years again a booster. That's it. Thereafter every 10 years TT vaccine can be continued, but not before 5 years. Now, Hemophilus influenza B is another vaccine against vaccine preventable disease. So this usually causes pneumonia and meningitis, very common in children less than 5 years of age. So DPT combining with Hemophilus influenza with IPV, we have a combination vaccine also. Combination vaccines are also available now in both government and private sectors. So polio, if added again to this, it forms a 6 component: diphtheria, pertussis, tetanus, polio, hepatitis B, and hemophilus. So these 6 forms hexavalent vaccine. So a kind of hexa vaccine, not the valent. So these 6 components you are getting in one shot. So this vaccine you can opt in private practice. In government, you need to take Penta 5, so diphtheria, pertussis, tetanus with Hemophilus influenza and Hepatitis B. You will take IPV separately. Now, next most important vaccine is pneumococcal vaccine, pneumococcal conjugate vaccine. So majority of the pneumonias in children are due to this streptococcus pneumonia. So we have an important vaccine for this pneumococcal conjugate vaccine. So this has to be taken at 6, 10, 14, at 15 months. So total 4 doses, 3 plus 1. So pneumococcal conjugate vaccine, again we have 10 valent or 13 valent. So the number of serotypes against which this vaccine gives protection, we label them as either PCV10 or PCV13. So 13 has got extra those 3 serotypes against which direct protection, and PCV10, what they claim is all these 10 itself are sufficient enough, they will give cross protection to other serotypes. So direct versus cross protection theory, again, thing to get biased, but something should be given to the child, either PCV10 or PCV13, without which it's definitely at a high risk that the child will land in pneumonias. So pneumococcal conjugate vaccine is very, very important. For the elderly also, we have pneumococcal vaccine, not conjugate, it's unconjugated one. So it's Pneumovax. It's a polysaccharide vaccine, PPV23. So that vaccine is highly recommended for old age and elderly people. So I have covered 6, 10, 14 vaccines, in which we also have Rota vaccine. It's a oral vaccine. So rotavirus is very important virus which causes majority of diarrheas. You cannot ignore rotavirus associated diarrheas. This will cause uh, hospitalization also. This diarrhea associated with rotavirus is very severe. So compulsory vaccination is recommended at 6, 10, 14, and at that's it, 6, 10, 14 weeks. So there are 2, 3 brands. One just gives at 10 and 14. One gives all the 3, again penta or bivalent. So something should be taken. Child should get rota vaccine. Sometimes what happens? See, all the vaccines, even if they are delayed, they should not be denied. Only for this rota vaccine, there is certain age cutoffs. Like first dose should be taken by 4 months, that is by 16 weeks itself. Before 16 weeks itself, the first dose should be completed, and the last dose should be completed by 32 weeks of life. So you cannot cross these boundaries for rotavaccine. But for others, it's not so. Whatever amount of lapses has happening, you should definitely finish the series. This is called catch-up schedule. Pediatrician will guide you how to design the duration and intervals between the vaccines, the number of doses as well. So the other vaccine which comes at 6 months, that is flu vaccine. Influenza vaccine is very, very important. The flu associated pneumonias definitely on the higher incidence. So hospitalizations will increase. So influenza has to be compulsory controlled. Only way is vaccination. Unlike other vaccines which are giving very good lifetime protection, this vaccine protects for 1 year, because there is yearly change in the virus form. So strains are changing yearly basis. That's why we mention it as annual influenza vaccination. So it is recommended for all the children and adult population and the elderly population as well. So influenza, first below 1 year, it is given 2 doses with yearly shots thereafter. But for adults, it's like yearly flu shots. So anyone can take anytime, preferably before monsoon in the April-May season. The other ones, very, very important vaccine, are measles, mumps, rubella combination. Measles is again, will get that entire body rash, fever with rash, classical rash presentation. Mumps is the parotid gland swelling. Rubella is again a form of fever with rash. So these are highly contagious. So MMR, this vaccine, the minimum age at which taken is given is 9 months of age. less than 9 months, usually we don't give. So first dose at 9 months and second dose at 15 months. And again, third dose usually before going to school, that at 4.5 to 5 years, one more dose is given. So the other one which comes will be meningococcal vaccine, meningitis causing one. For all travelers, UK, Canada, Africa, and European countries, compulsory it is indicated. Even in India, for the endemic zones we have, should definitely. But now it's like good that you take and you can travel anywhere, because identifying the endemic or epidemic areas is also very difficult. So meningococcal conjugate vaccine can be taken ACYW1 above 9 months age onwards. So 9 months we have MMR, OPV, and this meningococcal conjugate vaccine. Typhoid vaccine again initially was given between 9 to 12 months. Now from 6 months onwards you can give typhoid vaccine at any point of time. So usually it is given one dose only. Now the second dose at 2 years is removed. So typhoid conjugate vaccines gives good amount of protection against enteric fever, typhoid fever. So usually the complications associated with typhoid is very high, causing intestinal ulceration, meningitis. So that all is reduced with the vaccine. We have hepatitis A vaccine at completion of first birthday. So this is spread through water, causing fever and jaundice. So hepatitis A vaccine is very important at the time of birthday. Then thereafter we come after 1 year, all the boosters of what we give. So at 15 months we repeat. Now here comes first dose of chicken pox. So chicken pox dose usually at 15 months, and 3 months later second dose is given. The rest are all boosters. You give MMR second dose, then you give pneumococcal booster, you give DPT boosters, DPT plus IPV plus Hemophilus influenza. So that booster is given at 16 to 18 months. At 18 months, hepatitis A second dose is given. So you repeat meningococcal conjugate second dose any point of time, usually after 6 months of the first dose. And at 4.5 to 5 years, so from 18 months onwards, after which you come in yearly once for flu shots. And again that 4.5 years you take this DPT booster, DPT plus IPV1, and you can take this MMR and chickenpox. You get at 10 years, you get that Tdap vaccine, that is again diphtheria, tetanus, pertussis at 10 years. And we also have one important vaccine, human papillomavirus vaccine, so HPV vaccine, which for girls protects against cervical cancer, and for our boys genital warts protection is given HPV. Now the latest HPV, nanovalent HPV 9 is claiming to be claiming for protection against oral and other cancers as well. So HPV 9 vaccine is also recommended for both boys and girls at 10 years of age. COVID-19 from 12 years onwards in India, Indian regulations. So that's another vaccine added on to your list. So this is all about brief introduction about various vaccines. Now, all this schedule sometimes gets skipped and you may not be on time coming for the vaccination. No need to worry. Better late than never. So you can come any point of time, preferably on time. If not possible, whenever you come, ensure that all the missed ones are also done compulsory. And how to schedule the missed ones with the current ones pending, that all pediatrician will take care. Now the other problem comes is some may land in some complication with the vaccine. Earlier, usually such children are discussed on a case-to-case basis, and the decision is ultimately given, taken mutually, both with pediatrician and the parents. So we are still hoping for malaria vaccine, dengue vaccine, HIV vaccine, shingles vaccine, this herpes simplex vaccine. So there are many other diseases against which we are still now worried about. Now the current outbreaks of adenovirus infections, as you are all seeing, fevers lasting for 4 to 5 days. So very soon that also vaccine may arise. So whatever vaccine is research is done and introduced into the market after after safety and trials, human trials are done. So such vaccines which pass on all these safety trials should definitely be considered by us as a means of public health protection, so and preventive measure, so that if one child is also left out, they may harbor the disease and become a reservoir, posing a threat to others. So when everyone in the society is vaccinated, very soon the diseases also will go away, leading to an eradication from the world itself. So let's work together and increase the vaccination coverage. Vaccines can be delayed but should not be denied. So you can just delay or postpone but should not deny. And whatever doubts and myths you have, pediatricians are the right person, and you can even reach out to me. We will clarify your doubts in detail, because we spend a lot of time, we read in detail, and we have got enough experience handling these vaccines. So we have given to majority of the kids. So rather than listening to the word of mouth spread from others that this vaccine is not good, that is not good, and this causes so many side effects, or this is not important, that is most important, how eligible are they to spread such rumors when people like us, who are well qualified enough to share the right information, you cannot trust the information which is wrongly propagated. So always take the word from the right mouth and believe in the right person. So visit pediatrician and finish off all the vaccines on time for your kids. So that's all for me to update briefly on the immunization in children. Um, any questions? You please post your questions in the comments box. My number you can contact through 9866 You can drop a mail, Khanna MBBS, KHANNA MBBS at gmail.com. You can reach out to me through KIMS, Cuddles, Kondapur. I work there in the evening hours. Morning I am at Jubilee Hills, KIMS Mother and Child Center at Eternal Aesthetics, 4th floor, Jubilee Hills, Film Nagar Road, opposite Film Nagar Cultural Center. So you can meet me there morning between 10 to 1, evening 3 to 5 at KIMS Cuddles, Kondapur. So I end my session. You can just drop on your queries to my personal number or mail ID as given. You can schedule your appointments with 040-4243-4243. Thank you for giving me this opportunity. Thank you all.